Thank you and welcome to the show this morning. The topic this morning is Harmony Family Health Care Center, and we're fortunate to have with us three individuals from Harmony to talk about health care in Nashville as well as health care in general. Our first guest is Miss Ethel, or Dr. Ethel Robertson, and she will give us some information about her background and additional information, as well as information about Harmony Health Care Center, which will be followed by two other individuals who will join us, Miss Barton and Miss Crawford, and that will be followed by the three of them coming together to give us a round table discussion dealing with Family Health Care Center. And now, Ms. Robertson, Dr. Robertson, let's give you an opportunity to start us off by talking about your background, your education, and giving us a little information about that, and then about the organization itself, about the institution itself, Harmony Health Care Center.
Okay, thank you, Dr. Haney, for allowing us to be here and myself to be here in particular. I am Dr. Ethel Robertson, and I was born in Detroit, but moved here when I was a very small child. I had the opportunity to grow up right here in Nashville, Tennessee. Went to Tennessee State University with my BS in nursing. I had the opportunity to go to Belmont University and receive my master's degree in nursing. My next master's is in social gerontology from Fisk University. And then I obtained my doctorate from Tennessee State University in education with the emphasis in higher education. Had the awesome opportunity to go to Harvard, and I received a certificate in end-of-life care. So that's my background, and I've had the awesome opportunity also to work here in Nashville in several capacities, teach on faculty at Tennessee State University, taught at Meharry Medical College and Austin Peay State University in the School of Nursing, and of course at the Medical Center at Meharry. Worked at Vanderbilt University, and I've had the opportunity to see many people in our community as a family nurse practitioner.
And of course, you've got a lot of information about Harmony Family Health Care. Let's give a couple of statements in reference to that before the end of this segment.
Fantastic. Harmony Family Health Care was created in the minds and heart of three women, myself, Carlotta Crawford, and Maureen Barton. We have worked, I think, tirelessly to serve our community as nurse practitioners and as nurses. And what we decided to do was come together as a group and serve our community, and we established Harmony Family Health Care. We wanted to be in the North Nashville area to serve that community because it's a very special community to us, and that's where we are. We love that.
And of course, others will talk about some of the things that are happening at Harmony Health Care, and we've got about, I'm not exactly sure about the time that we have here in reference to this. Are we running out of time in reference to this? Are we out of time in reference to this? How much time do we have? We've got 2 minutes, you know, and so let's make a couple of other statements in reference to Harmony.
Okay, all right. I think we have an eclectic group of providers. My, of course, background is family. I'm a family nurse practitioner, and I can see from birth, those individuals from birth through old age. But my colleagues are practitioners who deal mainly with women's health, and they are midwives. Probably together they've birthed over 1,000 babies right here in Nashville, Tennessee, and I have the privilege and honor of working with these women. They are not only courageous but extremely knowledgeable, and I think we together will be able to help impact the health of not only the North Nashville area, but of Nashville, Tennessee, and that's what we want to do.
And you've got a program you think that is general, that not only can you apply that program here in Nashville, but the problems that you're facing here are generally problems that we face all across the nation dealing with family health care.
Absolutely, absolutely.
Very good. And of course, I'm not sure again about how much time we have, and we've got 1 minute left now. I think time only recently showed up, and that's why we seem to be stumbling through this, because we really don't have any time in reference to it. But I think we've got about 51 seconds now, and you'll have an opportunity, Dr. Robertson, to tell us additional information in reference to this after we deal with Ms. Crawford and Ms. Barton. And I think you've already given us an excellent introduction to these individuals, because these are the persons that are really doing the hands-on kind of work for Harmony Healthcare
Absolutely.
Center.
We
Very
all
good.
three are. Absolutely.
Very good. And we're glad to hear that. And of course, we're getting ready for this first commercial break for the third time here. But you know, this is the way it often happens. It sometimes happens, and we certainly wish to apologize for that. But we'll be back with our audience following this very, very short commercial break.